Question number 2, Jamie Greene.
To ask the Scottish Government whether it will consider holding a public inquiry into deaths in childbirth in NHS Ayrshire and Arran.
Cabinet Secretary Shona Robison.
The death of any mother or baby in childbirth is a tragedy for all involved. Following concerns raised by local parents, I've asked Healthcare Improvement Scotland to undertake a rapid review of the processes Ayrshire and Arran have in place to review and capture learning from significant adverse events, and to look at the internal investigations that the board have undertaken. I've offered to meet with the parents concerned on conclusion of that process. I should say that we do have the lowest ever recorded maternal mortality rate and stillbirth rate in Scotland. Last year, 88 babies were born alive as a result of the processes that we have in place to drive down the stillbirth rate compared with the 2011 figures. But we are certainly not complacent, and a programme of work is underway led by the Scottish Government Stillbirth Group that I established, and through our Scottish Patient Safety Programme, to better understand the incidence and causes of stillbirth to continue to drive the rate of stillbirths down further.
Jamie Greene.
I thank the Cabinet Secretary for a response. We welcome yesterday's announcement into an HIS review, and naturally our condolences are with all the families involved in these cases. But in the tragic case of the Morton family, they wrote to the Minister in January of this year, then again in May. My colleague Brian Whittle followed this up with a letter in June, and finally a one-page cursory response was received from the Minister in July. In her response, the only reference to a review is that of a pre-existing government review into maternity services announced the year before. So may I ask the Cabinet Secretary, why has it taken FOIs, whistleblowers, a BBC investigation and negative press headlines, and indeed the lodging of this topical question in Parliament today, before the Cabinet Secretary finally accepted that this was a serious problem and announced a formal review?
Cabinet Secretary.
Can I say first of all that some of the, at least 3 of the 6 cases that have been mentioned so far predate his review that was carried out in 2012. And let me just go back for a second to his review in 2012, because there was a detailed review of the adverse event management in the spring of 2012 at the request of the then Cabinet Secretary, and some improvements have been made. And I think it's important to say that within Ayrshire and Arran, as well as the rest of Scotland, the deaths of neonatal babies and the rate of stillborns and indeed maternal deaths have reduced. So that's something that we should acknowledge. However, what I want Healthcare Improvement Scotland to do is to look at some of the concerns raised by the families about the processes and procedures followed or not followed by Ayrshire and Arran. What I want to assure myself of is that what was supposed to happen in each of those cases did happen, and if not, we need to know why that was the case, and to reinforce with Ayrshire and Arran, and indeed any other health board, that when there is a significant adverse event, that there are very clear processes that has established that should be followed, and indeed if it comes to a reference of a case to the Crown, that there are very clear guidelines there as well. I want to assure myself in all of those cases that those processes were followed, and if not, then action will be taken to make sure that the lessons are learned from that.
Jamie Greene.
Again, I reiterate that we do welcome this specific review, but we also want to make the point that all potential options for audit and scrutiny should be on the table, including the option of a third-party inquiry, and I wonder if the Cabinet Secretary will agree to that suggestion. The issue that a lot of people have, Presiding Officer, is that 4 years ago, a similar HIS review into NHS Ayrshire and Arran made very specific recommendations on what could be done to improve the reporting of significant adverse events. Previous reports also flagged problems around fetal heart monitoring, for example. But staff shortages are preventing midwives from being able to attend these mandatory training sessions, and the Health Board is still failing to carry out serious adverse event reviews. I ask, therefore, in addition to this HIS inquiry announced yesterday, what further measures the Government is taking to ensure that any recommendations coming out of an inquiry or review are not just acknowledged, but acted upon, and if the Cabinet Secretary will take personal responsibility for overseeing this process.
Cabinet Secretary.
Well, just let me remind the member that when the first review in the spring of 2012 was carried out, Healthcare Improvement Scotland developed a framework and a programme of reviews. So it was to try and ensure that there was a consistency in approach to managing adverse events. So that national framework was published in September 2013, and then it was refreshed again in April 2015. And in 2015, Healthcare Improvement Scotland also held a series of progress meetings with boards to understand how they were continuing to implement the national framework. So there was action that came out of that review in 2012. New procedures were established, and indeed his went back to make sure that those processes were being carried out. What I need to understand about Ayrshire and Arran is, in those cases where families have raised concerns, were those procedures and processes followed, bearing in mind that half of the cases predated that review in 2012, and that's what we need to know. Now, in terms of any action after his report to me, we need to wait and see what his say before we judge whether further action is required. But I would expect all boards, and I've asked my officials to make sure that all boards are reminded of the processes that are required to be carried out when there is a significant adverse event, and also to remind them of the guidelines for referrals of any cases to the Crown Office. Now, the member also mentioned the issue of staffing. What I can say is that we have an increased number of midwifery staff in the NHS. There's a 4.1% increase in the number of midwives over the last few years, since September 2007 to June 2016. And overall, NHS Scotland meets the Royal College of Midwives' recommended midwife-to-birth ratio. But we also are aware that sometimes there are challenges in particular areas. But in Ayrshire and Arran, they have recently recruited 6 additional midwives to the team and are planning further recruitment later in the year. The national review that is coming to me in the next few weeks is also looking at and working with the Royal College of Midwives to make sure that the models of care being delivered in our maternity and neonatal units are the best that they can be, and that was also looking at what the workforce tools should be in taking that forward, and I'm very happy to make that review available to Parliament.
There's a huge amount of interest in this subject. I'm only going to take one more question. There's no more time, I'm afraid. Brian Whittle.
Thank you, Presiding Officer. I've been working with my constituents, Mr Morton and Miss Logan, in investigating the tragic death of their son Lucas. And in scrutinising action plans produced from a previous root cause analysis review, we were shocked to discover that areas recommended for improvement in 2010 were the same areas that failed them and their son 5 years later. How can Mr Morton, Miss Logan and the public have any faith in any new government review when the lessons have not been learned nor recommendations implemented from past systems failings, which after all is all that Mr Morton is looking for?
Cabinet Secretary.
Well, that's precisely why it's very important that I understand whether or not the processes and procedures that Ayrshire and Arran were supposed to have followed were followed, whether that's in the Morton family's case or any other of the cases that have been raised. I need assurance of that, and if they haven't been, then we will take action to ensure that that happens. The 2012 review, that was the previous review, did establish some very, very important changes to ensure consistency in applying the significant adverse event processes, and indeed making sure lessons were learned, and that there should be standardised criteria for example, referral to the Crown in those cases that were appropriate. If there are cases that those processes have not been applied properly, then I will absolutely take action to ensure that that is addressed, and I have offered to meet with the families once I have his report to discuss the findings with them, and I would extend that invitation.